In this short video, I'm going to give you my top 3 reasons why I prefer to program box squats during pregnancy rather than your traditional barbell back squat. So if you're currently training during pregnancy and want a safer alternative to your traditional barbell back squat, this video is absolutely for you. Now, of course, there's a number of reasons why I prefer the box squat during pregnancy, but I use them for a number of different clients, not just the pregnant ones. But my main reasons for using them during pregnancy are the elimination of the stretch reflex and how this breaks the lift down into the concentric and eccentric phases of the lift, allowing for greater control, the decreased range of motion and allowing the lifter to hit consistent depth every time, and a more posterior muscle group focus. So let's talk about all of these in relation to pregnancy. And when it comes to a more posterior muscle group focus, you need to take into consideration when training during pregnancy the postural changes that are happening and how these affect your muscles. So with your growing bump comes a change in center of gravity, causing your pelvis to anteriorly tilt. And what this does from a muscular perspective is it places more load on your lumbar erectors, your hip flexors, quads, adductors, and calves further down the chain. So your traditional barbell back squat has more emphasis on your quads, a muscle group that's already under more stress than usual due to your pregnant posture. There's also greater stress placed on your knees in your traditional squat. And if you've trained a large number of pregnant women, you'd know that knee pain is actually a really common complaint. The box squat, in comparison, is a much more glute and hamstring dominant movement, as it forces you to sit back into the squat and use your hips to get out of the squat rather than momentum and speed. And when it comes to pregnancy, you want to try and have as much posterior chain focus as possible to help counterbalance what's happening posturally. And when it comes to the anterior pelvic tilt, you also have to remember that this change in your pelvis position can actually affect your usual squat movement pattern, as you just don't have as much hip flexion room as pre-pregnancy, which can cause your spine to compensate by going into lumbar flexion. Now, if you have the box set at the right height, that would actually stop this happening. Then, of course, you have to consider the pelvic floor, changes in your abdominals, and the effects of the hormone relaxin on your spine, your ligaments and tendons in all of this as well. And that's where the elimination of the stretch reflex, the consistent depth and decrease in range of motion all come in, right? So when it comes to the pelvic floor, the squat and stretch reflex, you need to remember that your pelvic floor is already under considerable load with the weight of the baby. And being a muscle, it can fatigue under just this pressure of the baby alone. So when you add load and full range of motion, this places even more pressure on the pelvic floor. And remembering at the bottom of your squat, your pelvic floor is going to be in a reasonably open stretch position. Then you have the stretch reflex as you bounce out of the bottom of your squat. And remembering your pelvic floor is suspended in your pelvis by 4 ligaments that hold it in place. So it almost has like a trampoline-like quality to it. And the stretch reflex of your squat has your pelvic floor pushed down, bounce back up, and then push back down again. And the best way that I can kind of describe this is it's kind of like when you're a kid on the trampoline and you double bounce someone and sent them flying. I don't know, maybe that was just me. But imagine that, but it's your pelvic floor, right? So the box squat takes out the stretch reflex and breaks the lift down into the eccentric and concentric part of the lift. And what this does is it slows everything down and allows you to focus on your breath and technique. You know, things like making sure that you're using your TVA breathing and connecting to your pelvic floor, but especially in the concentric phase of the movement. And again, from a purely squat mechanics kind of perspective, the box squat teaches you to use the correct muscles to get out of the squat rather than relying on momentum and speed. And when you're dealing with the spine spine that's already more mobile than usual, and ligaments and tendons that just have more laxity in them than usual, slowing down the movement and limiting the range of motion increases the safety factor and helps protect your pelvic floor as well. Now, when it comes to squats, there's a little bugbear that I have, and that's seeing people load up the bar and literally do like tiny quarter squats, or as they go heavier, their squats get shallower and shallower, which is another reason I love box squats, because it forces you to be consistent with your depth every single rep. And of course, you can manipulate the depth of the box depending on what you're trying to achieve. And for someone, say, who's used to hitting depth with their squat when not pregnant, using a box to just reduce their range of motion by, say, 30% can actually be a very helpful feedback tool. So it's for all of these reasons why you see me utilize a box squat with pregnant clients. And if you're currently training during pregnancy, I absolutely encourage you to do the same. So that's it from me today. I hope this video helped. And of course, if you would like more in-depth pregnancy-specific content, feel free to apply to my complimentary but private community, the Preggy Training Crew. The link is in my bio.